New COVID-19 vaccines are coming to the U.S. this fall, but many Americans may not take them. Pfizer, Moderna, and Novavax are expected to release new single-strain coronavirus shots targeting the Omicron subvariant in September.
WKYT's Kelsey Soto has more on the numbers and what health leaders are preparing for in the coming months.
Call it pandemic fatigue or confusion of personal risk levels, but an additional COVID-19 shot may not be on everyone's fall agenda.
I think the goal is getting to similar to the flu vaccine, how it's an annual vaccine targeted towards strains that you're seeing in the community.
Data from the CDC shows there were 7,100 COVID hospitalizations nationwide from July 9th through the 15th. That's a 10% jump from the week before. In the ER, 0.73% of visitors had COVID-19, up nearly 50% from the month before. But this time last year, hospitalizations were above 40,000, with 5% of ER visitors testing positive. Health experts at Baptist Health say they were surprised to have no COVID patients just a few weeks ago.
But after having gone down to zero about 3 or 4 weeks ago, we're up to about 4 or 5 patients now in the hospital today. When I looked at the rest of the 8 hospitals in the Baptist system, we have a total of 25 patients out of all 9 hospitals.
The increase seems to be driven by human behavior. More people are traveling this summer for vacation, and the record-breaking heat is driving people to congregate inside where it's cooler. And a new school year is right around the corner.
And hand hygiene with the kiddos, washing hands, and because that stuff, once it starts spiking up in those, daycare, schools, everything like that, it really does spread.
The CDC says only 17% of the U.S. population got the latest bivalent COVID vaccine since they were approved last September. They hope that will change with new messaging in the coming months. In Lexington, Kelsey Soto, WKYT.
A June poll conducted by Gallup found that 64% of Americans think the pandemic is over in the U.S. and only 18% are worried about contracting the virus.